let's talk about one of the most interesting phenomenon, which is the placebo effect. The placebo effect usually triggers an eyebrow raise or two among even the most hard-nosed of skeptics. We may not be able to forecast the future or move a physical object with our minds, but the placebo effect is nearly as marvelous. Many researchers call it the coolest and strangest thing in medicine. Let me explain a little bit about the story and what we mean by the placebo effect. The term placebo effect is a shorthand for how mere beliefs about the effectiveness of an inert treatment or intervention can lead to a demonstrable health benefits or cognitive changes. An apparently incontrovertible demonstration of the near magical power of the mind over matter. Naturally, this is not literally magic, of course. It can be also interpreted as a form of conditioning response in which alone a psychological reaction occurs in absence of the original trigger. Our beliefs are the subjective echo of physical process in the brain, and this constellation of neurochemical and electrical events and their downstream effects underlines the placebo phenomenon. Naturally, to research psychology, the placebo effect is not always a phenomenon of wonder, but a methodological problem. And research must go to extreme length to rule out the influence of participant expectation as to establish which observed effects are truly attributable to an intervention. At the beginning, for the placebo effect to occur, usually there is somehow a deception. A deception is required because what we need to do is to trick the patient into thinking that an inert treatment is actually a powerful drug or something similar. But this need of trickery that has long meant the deliberate inducement of placebo effect in mainstream medicine has been seen as unethical and has been posed some problems. However, nearly 10 years ago, research showed that people, for example, with irritable bowel syndrome, showed a greater improvement after being given a so-called open placebo. So the open placebo is when participants are told that they are given an inert substance compared to receiving treatment. So research divided two groups of people. One group was given the actual drug, and another group was given what we call an open placebo, a saline solution, a pill with no effect whatsoever. What happened is that this physical impotent treatment trigger a response within the body. So the participants that were receiving the open placebo showed some improvement in their syndrome, in the irritable bowel syndrome. So the open placebo, in terms of ethical constraints, bypass some conventional barriers to the clinical use of open placebo. Some open placebo didn't show any effect, for example, when in a specific area of medicine in terms of wound healing. So with anything regarding an open cut in the body, in the skin. But there is evidence that different forms of placebo vary in effectiveness. So, for example, 2 pills are better than 1 pill. Also, the blue pill, it's paired, is usually associated with a sedative compared to the pink pill. Branded placebo pills are much more effective than pills without any labeling, for example. And injection filled with nothing other than saline solution are more powerful than pills. So you see that the placebo vary in terms of how effective it is. So there are different lists of priorities in terms of the placebo effect. One of the most astonishing demonstration of the placebo effect involved a placebo brain surgery. Specifically, the research showed that patients with Parkinson's disease who undertake a form of placebo brain surgery, supposedly, so they were told that they were being operated on the brain with a brain surgery, but not really involving the injection of stem cells in the brain, compared to patients with Parkinson's disease that received the injection of stem cells. The placebo patient showed greater symptoms improvement than the patient who actually received the treatment. So in this research, there was a very strong effect of the placebo. And this opened up some, question about placebo-controlled surgical trials, which is another area of medicine. In terms of placebo, a lot of research has been done, and certain personality traits are associated with it being more likely that a person will experience the placebo effect. For example, optimists are more responsive to analgesic placebo. People who scored higher for emotional resilience and friendliness. Also, curiously, the traits related to placebo response vary according to the condition being treated. In the context of stress, for instance, one study found that it was the more pessimistic people and the less empathetic participants who showed a greater placebo response in the context of stress. And personality traits appear to play an important role in the placebo effect, but no data suggest that age and gender are relevant. So they're not influence the placebo effect. A placebo effect depends also on patient believing in the power of treatment being given to them, it follows that some doctors will be better placed to reinforce this hope and expectation than others. So, in other words, if you receive the placebo effect is stronger when the person who give you the placebo is a doctor with a classic white coat and is friendly. It has a greater effect. And also when the doctor use the injection as such. Yes, this is the most powerful placebo effect is through injection, which is very interesting. Another study found that subjective pain was lower after the medical procedure was given when participants thought they've been paired with a doctor who shared the same values and personal beliefs. And I also wanted to mention another very interesting and fascinating study about sleep and placebo. So researchers tricked participants into thinking that they had more sleep than they actually had. And then they observed how this affected their performance the next day. So the researcher achieved this deception by wiring their participants to various psychological measures and then give them some false feedback on how much REM sleep they had had. After hearing that they had had an impressive amount of sleep, participants performed better on test language and arithmetic. Another study showed health gains among, for example, hotel cleaning staff who had been reminded that the work counts as exercise, including in terms of improvement in weight body mass index and body fat waist hip ratio and blood pressure. So even if in reality when you work as a cleaner in an hotel you shouldn't have this positive effect, having been told that this is possible made these people lose weight and have a less high blood pressure. And then there is another very interesting finding. For example, in animals, in the case of rodents, research have paired an active drug such as morphine with a particular taste or smell, and then show the analgesic effect still occurs when the same taste or smell is repeated but without the drug. Of course, one can argue that this is not so much a placebo effect, but a form of conditioning response. However,